In the deep dive tonight, the CDC is classifying its response to hantavirus as level 3. That's the lowest rank for an emergency. Now, the cruise ship at the center of the outbreak is expected to arrive in the Canary Islands on Sunday.
The CDC says from there, it will take American passengers to a quarantine unit in Nebraska. National correspondent Atra El-Nashar reports.
One cruise ship making global headlines has many asking, what exactly is hantavirus, and are we in for pandemic 2.0?
The risk to the public remains low, but we're following that, reassessing that regularly.
I don't know, man. I don't think I have another, global crisis in me.
Start praying, bro.
According to the CDC, hantaviruses are spread mainly by rodents. The particular strain of concern is called the Andes virus, the only type known to spread human to human.
This particular strain of the hantavirus is quite lethal. Now, that is not to say this is the next pandemic.
It's spread through touching an infected rodent or their droppings or saliva, close contact with an infected person, or touching a surface with the virus on it and then touching your eyes, nose, or mouth. The epicenter of the outbreak? The MV Hondius, a Dutch vessel with about 150 passengers and crew on board when it set sail from Argentina April 1st.
There are 8 cases, including confirmed and suspected, and 3 people have unfortunately died in this outbreak.
To put those numbers in perspective, 890 cases of hantavirus were reported in the U.S. between 1993, when surveillance began, and 2023, according to the CDC.
It's very much, we hope, under control. We have a lot of people, a lot of great people studying it. It should be fine, we hope.
As of Friday, 6 states are monitoring people who either disembarked the MV Hondius before the outbreak was detected or others who may have been exposed to them: New Jersey, Virginia, Georgia, Texas, Arizona, and California. The World Health Organization explains how they and those yet to leave the ship will go through contact tracing. First, their level of exposure to the virus will determine their risk level. That risk level will determine if they need to monitor for potential symptoms. In Washington, I'm Atra El-Nashar, 7 News.
As Atra said, Virginia health officials are closely monitoring the health of the lone passenger from that expedition cruise ship who is now back in the Commonwealth.
And they'll soon do the same for others who will follow. And our IT investigator, John Barr, has been tracking that part of the story for us tonight. He joins us now in studio with more. John?
Well, Scott, Michelle, Virginia State Health Commissioner Dr. B. Cameron Webb is not identifying the passengers from that ship who are either home now or on their way. The state is even refusing to say what county they live in. But Webb says health officials will monitor their conditions to protect the public.
That passenger who arrived back in Virginia has been in touch with our local health district, has been receiving guidance from the health district in terms of what symptoms to look for and what those contingencies are. But that individual this time is not showing any symptoms, and we're continuing to stay in pretty constant contact with them.
How concerned should the public be about this?
At this point, I agree that we shouldn't be alarmed. We should be alert.
Professor Donald Milton is an internationally recognized expert on the airborne transmission of pulmonary diseases. He tells 7 News hantavirus, and specifically the Andes strain of it, which has been identified in this case, can be deadly in roughly 25% of cases, and says even if someone isn't symptomatic, they should wear surgical masks out of an abundance of caution.
It looks to me like this will be something that can be contained. And if we're proactive, we will see less spread than we saw, a lot less spread than we saw with SARS, and nothing like COVID.
Hantavirus begins with flu-like symptoms, which won't appear until between 4 and 42 days after contact. Early symptoms include headache, fever, nausea, diarrhea, cough, or loss of appetite. More severe symptoms include shortness of breath, chest pain, or tightness, and difficulty breathing. There is no specific treatment.
I don't think there's a COVID-like outbreak potential when you're thinking about hantavirus.
Dr. Amira Roas is an infectious disease expert and professor at George Mason University, who worked as an outbreak investigator for the CDC.
Because this virus does carry with it a risk of both person-to-person transmission and can be extremely deadly, we do want to be extra cautious. We want to make sure that those who have a known verified exposure do in fact quarantine.
I think the key for us is making sure we're in touch early and often, right? As we're monitoring really closely, that way we're able to really wrap the public health apparatus around them and do the work that we know how to do and that we're trained to do, and that's to keep the public safe.
Now, you just heard Professor Donald Milton reference the SARS epidemic. While SARS claimed more than 700 lives worldwide from 2002 to 2004, there were no deaths linked to SARS within the United States, and it was nothing like the COVID-19 pandemic, which contributed to more than 1.2 million deaths just in the United States alone. So when he says more like SARS and nothing like COVID, Scott, Michelle, that's good news.
Yeah, it is, and it's some really good perspective you're providing there, John. Thank you. We want to hear from you about this. You can scan the QR code that's on your screen to vote our question of the day. How concerned are you about hantavirus? Look at the results right now. 35% saying not at all concerned, 40% somewhat, and 25% of you who've responded so far are extremely concerned. Now, you can find this poll on WJLA.com. And that's also where we'll continue to bring you new developments as health officials closely monitor this situation.